Hi, I'm Paul Thomlinson, a psychologist and executive director of the Compass Health Research Institute, whose mission is to discover, create, and disseminate useful information that answers important questions and helps solve important problems. We think the problem of helping people better understand and embrace the need to be vaccinated against COVID-19 certainly qualifies as one of the more important problems of the day. So for that reason, we asked Compass Health Network's Chief Medical Officer, Dr. Katie Friedebach, and our regional medical directors, Doctors Chad Fowler, Michael Shoemaker, and Andrew Quint, all primary care physicians with many decades of combined training and experience in improving health, to engage in a discussion aimed at answering the most common questions you may have about these vaccines: what they are, what they do, how they were developed and approved, concerns about effectiveness, concerns about safety, and other concerns that might contribute to people being hesitant about getting vaccinated. Our hope is that we'll bring light to a subject that often feels confusing or scary to people, and about which they may have very strong opinions. So if you're among those who are undecided about getting vaccinated, which is between 20 and 40% of you, depending on the survey, we hope to speak especially to you, to answer questions you may have and provide a path forward that makes you feel comfortable with the decision to be vaccinated. And if you're among those who may have decided against it, we hope you hear something that opens a door to new consideration of getting the vaccine. So thanks for joining us for this important discussion. Well, thank you all for being here. Appreciate you sharing some of your time today for our COVID vaccine discussion. I'm looking forward to hearing from each of you about your perspectives on the vaccine, including, if you're comfortable with it, your own sort of why as regards the vaccine. And by the way, I wanted to share my why, which I got the two-dose Pfizer vaccine as soon as it was available to me. And my why is that I'm convinced that that's part of the way out of this forest fire of a pandemic we've been in for over a year now. And also, having survived COVID myself back in August and September, it has the happy effect of also protecting me personally against serious illness and death by COVID. So that's a pretty important thing to me, having survived it already. But on that note, I'd like to ask you, Dr. Friedebach, as our Chief Medical Officer, to give us any background information on COVID-19 that you think folks might need to know as regards, why we should get the vaccine, and then to lead our discussion with the other docs about common questions and concerns about the vaccine.
Yeah, no, thanks, Paul. I think starting with the why makes good sense as I kind of think about my own personal why. It's something that I moved from anticipation, excited about the vaccine, to action. And it's so important that we really think about the impact that it has on us personally. I also got the Pfizer vaccine, and I'm in the same boat. I got it December 17th, and I got my second shot January 8th. My personal experience was it was just like a flu shot. It didn't really, I had a little bit of soreness in my arm, but I didn't have any other side effects. And I just, really, it went great. But to some extent, the why has to do with a little bit of the experience that I had following. The side effect I didn't anticipate was the pride I would feel, and then also the relief that I felt. And I've heard that from other folks too, as they've talked about it. When I was getting that shot, I was proud of our scientists. I was proud of our country. I was proud of the clinic that I was working at, that we were fighting the pandemic in that way. But as for me, and this is where I get to my why, right around that time, my 19-year-old daughter was scheduled for surgery, pretty major surgery. And after I got the COVID vaccine, I realized just how much I was kind of worried about that surgery. Would I get COVID before she had surgery, and then I wouldn't be able to be at the hospital? I wouldn't be available to help her recover. And once I got that vaccine, it was like, not only did I have the pride of, hey, we did this and we're fighting this and we're going to do it together, but I had the relief of, hey, I didn't have to worry about that anymore. And that relief started to apply to everybody in my family who's vulnerable and who's at risk for serious COVID, that I can now be around with a little more confidence. All the activities that are important. I have high school age kiddos, that I'm not going to miss activities that are important to me because I'm going to have to quarantine, or I'm going to be exposed, or perhaps get sick. And so Like a lot of immunizations, when you think about the flu shot every year, we're getting it in part because, hey, I don't want to get sick, and that's fair enough. But the bigger item there is really that we're going to see patients day in and day out, and we don't want them to get sick. They could possibly have chronic medical conditions, perhaps their advanced age. So, to your point, it's just a really good opportunity for us to start fighting out of this pandemic. And so that's really my why, is my family, my patients, my community, really all of us. So I might pass it over to you, Dr. Quint. What's your why? And can you tell us a little bit of your experience?
Yeah, I got the Pfizer vaccine in December also, and just had a sore arm, no other side effects. I have kind of the same reasons. I have elderly parents, and I want to be able to see them and not be concerned about passing it to them. I have a 95-year-old mother-in-law, and I want her to feel comfortable being around me, and I want to be able to see her and help out. I want to protect my wife, who unfortunately, didn't fall into a high risk category. I mean, not, that's a funny thing to say. Not unfortunately. Fortunately, she doesn't. However, because she doesn't, she couldn't get the vaccine. So I was coming home from work every day, potentially exposed, and she couldn't get protected. And that was a stressor. So, and then of course I have kids, and they couldn't get vaccinated early on because none of them have high risk. And so I wanted to be able to see them and feel comfortable that I wasn't going to give them something really bad. So those were my main reasons.
Dr. Shoemaker, do you want to share your why with us?
Sure. I too received the Pfizer vaccine in December, and both immunizations were both were uneventful for me. I maybe had a little mild headache and fatigue after the first one. The second one, I didn't notice anything at all. So my reason for doing it, again, I think is kind of reiterating what's already been stated, but there was some worry about what I was taking home to my family and what I was exposing them to. Um, uh, I probably had the highest risk factors in the family, but also we've all had a major impact on how we conducted community. And so I wanted to do what I could do to try to get back to some normalcy. And I have patients that come in and see me that certainly are high risk. So I'm protecting them. And then the other issue is, I felt like I as a healthcare provider was going to be, how are we going to get out of this situation? I was going to be advising patients, and if I was going to advise a patient that I strongly recommend that they get the vaccine, that I myself should step forward. So it's been a very positive experience for me, and certainly has been somewhat relieving to me. And as the data keeps coming forth, I think my recommendation to get the vaccine is getting stronger. So.
Wonderful. Dr. Fowler, do you want to give us your why?
Sure. I also received the Pfizer vaccine. Similar theme from what all of you all have mentioned, but I did feel a sense of relief immediately. I did not have significant side effects. I felt maybe a little soreness in the arm with the first one, maybe a little tired. The second one, I didn't really feel, have any significant side effects really. And so I think for me, I was thinking about all of the other individuals that I come into contact in my life on a daily basis that, not only wanting to protect myself from getting a, serious COVID-19 infection, but also for me, more importantly, it was my family members, loved ones, friends, coworkers, patients, and really just anybody I come into contact in the community. And I think it's definitely helped me feel a little bit more comfortable, going about my day-to-day activities. And I immediately felt a sense of hope too. So it was relief and hope. And I do believe that the vaccine is kind of definitely our vehicle to get us through the other side of this pandemic. So.
Yeah, I couldn't agree more. And the clinic where I had mine done, I was immunized the first day they did it. But they said in the morning, people were tearful. It was emotional. And I felt that too, kind of the excitement of we're making progress. We're pushing towards something that has great hope to end the pandemic. So
Sure.
as we kind of shift over into beyond our why, I thought we could kind of start with a little bit of education around the vaccine itself. And so, Dr. Shoemaker, would you mind kind of giving us a little bit of information about mRNA vaccines and how they work?
Sure. I think to best understand mRNA vaccines, it's important to kind of understand the structure or how this virus is built. When it's looked at under a microscope, it looks like a ring with some spikes around it, and so it kind of got its name by how it appears, and it's a class of viruses that had some familiarity with before this specific virus came forth. And these viruses are literally look like spikes, and so it looks like a crown. And so if you understand the word corona, that's what it references, is a crown-like structure. And so these spikes are actually proteins on the surface of the virus, and they actually serve the virus by providing a mechanism to attach to us and cause infection, and initiate that process of infection by attaching to us. And so these vaccines contain a genetic material or genetic template, let's call it a template, called messenger RNA, which codes for the building of this spike protein that's seen under the special microscope. So these spike proteins, our bodies can respond to immunologically. Our bodies respond by forming antibodies, and by also inciting another type of immune response in our bodies, so our bodies recognize when cells are infected. And so these specialized cells actually can attack an infected cells so that it helps to halt the infection sooner. So, so the question another really kind of reasonable question would be, well, what happens to this messenger RNA once it gets into my body? Well, it doesn't live very long. In fact, in the very early stages of these types of vaccines, which were kind of have been being looked at for decades now, this messenger RNA is hard to make live long enough to actually get into the cell and allow it to do its work. So it doesn't live very long in the body. It gets broken down very quickly, especially once it gets into the cell and starts producing this spike protein. And so the goal of this spike protein and the response our body creates to it is when our bodies get exposed to the virus, that it actually can bind to this spike protein on the surface of the live virus when we come in contact with it, and either prevent infection or at the very least prevent the infection from being worse than it would be otherwise, so a more milder case.
And what do you say to folks who ask you the difference between the Pfizer, Moderna, and J&J vaccine? Those are the three that are on the market right now that people are receiving. So how do you kind of describe how those vaccines are alike or different?
Well, I would say they're probably in the way they work, they're more similar than they are not alike. So let's say that up from the very beginning, they all have and use messenger RNA to accomplish their task of allowing the body to produce this spike protein so that we can respond and be prepared when we see it, when our bodies see it again. So the Pfizer and the Moderna vaccine, which were the first two that received emergency use authorization, were packaged or are packaged in a fatty kind of envelope, you can think of it. And I mentioned earlier that without this fatty envelope, that messenger RNA would get broken down before it could ever even get into the cell. So there are proteins in the body that wouldn't allow it to get to where it needs to get to. And so that fatty envelope serves that function. And then the Johnson & Johnson, or if you look at the CDC information, it's called the Janssen vaccine. It uses messenger RNA as well, but it's packaged in a non-disease causing adenovirus. These are viruses that commonly for humans, or the ones that cause infection in humans, cause the common cold actually. So, but this particular adenovirus has been developed specifically for delivering messenger RNA into cells. Literally, it infects our cells, and so protects that messenger RNA from getting broken down, gets it into the cells so they can actually do its job, and our bodies can produce the spike protein and the immune response, which helps in the event we come in contact with that virus.
Well, I appreciate that explanation. And, almost since the beginning of our discussion around vaccines, before they were even improved, I was getting questions about which one of the vaccines that might become available should I get, which one is the best. And so, Dr. Fowler, how do you talk to your patients about that if they ask you that question, which one should I get?
Yeah, that's a really good question. And I try to keep it as simple as possible. Just get the first one available. We have 3 available vaccines right now, and they're all highly effective. The take-home point with all 3 vaccines is that what they do really well is that they're highly effective against preventing hospitalizations and severe illnesses, and that's what severe illness, and that's really the most important. We're really trying to prevent those hospitalizations and folks dying from COVID-19 infection. So as soon as you can get the vaccine, the sooner the better. And if I think all 3 of the ones that we have available, the Pfizer, Moderna, and Johnson & Johnson are all excellent vaccines. The trials have slight differences in the outcomes that they monitored, but there were some, like the Johnson & Johnson was a little bit later, and there were some variants that they were playing a factor, but in general, they're all 3 highly effective and safe. So.
And what kind of side effects did the studies show that we should expect? We all had very mild side effects. Like I said, it was akin to a flu shot to me. I felt great, but what kind of side effects are they reporting in the studies?
So the studies are showing the most common side effects would be pain and swelling in the arm, fever, chills, feeling tired, headache. The side effects are mild to moderate, and usually last for anywhere between a day to several days. And about up to 15 to 20% of recipients will report a side effect. I found it interesting, and usually there is there may be a little bit more reporting of side effects, a little bit more with the second one than the first one. And I found it interesting to look at our own data from all of our Compass staff who have received the Pfizer vaccine, and I'll just give you a couple of examples of percentages on those. Again, the take-home point is that the side effects were low and mild, but With the first one up to 0 to 6% reported side effects, and of the side effects, injection site pain was reported at 6%, fatigue 5%, and headache 4%. And then the appreciably more significant side effects with the second vaccine were reported. However, they're still very low, with being fatigue 13%, headache 9%, muscle pain 11%, and feeling unwell 9%. So I think those are the common side effects that that we inform our patients and family, friends, anybody else that to watch for.
No, that's so helpful, and I appreciate kind of the background on the vaccine and kind of what to expect and the different types. And I really think it was helpful that we had survey of Compass employees around how they were experiencing the vaccine, if they had any side effects, and then just as important for those folks who were a little hesitant about the vaccine, what was it that they were concerned about? And so let's shift over there a little bit, and I'll toss it over to you, Dr. Quint, to kind of talk about, one of the things we hear is, this came together too fast. I don't want to be a guinea pig. I don't want to be the first person to get this vaccine. And so what do you say to your patients who kind of take that vantage point of this is happening too fast and we don't know enough about this vaccine?
Yeah, well, that is definitely a common concern and question. So first of all, I explained that the vaccines are tested by giving people in clinical trials either vaccine or placebo and then following them. And so really they're the guinea pigs. They already got it. And there were tens of thousands of people in these clinical trials for each vaccine that got this vaccine before it was approved, before any of the vaccines were approved. So when people are worried about being in the early group, really the early group's already gotten it. So we're earlier than some, of course, but we're not that early. And there have been over 100 million doses given already in the United States. There's very, very intensive monitoring to see if there are any side effects that got missed in the early trials. So in the early trials, there were very mild side effects, kind of like what you guys have already described. But of course, people worry that when enough people get it, some other side effects might come out that weren't detected. There are two major monitoring systems. One's called the Vaccine Adverse Event Reporting System, and one's called the vSafe program. And so that's continuously monitoring people, not only in the first few days, but for weeks and months after they get their vaccine to see if there's anything else that might be missed. And so we're at 100 million plus doses so far. And we so far have not picked up any serious new side effects that we didn't know about. So I feel, really comfortable about this. And I also, again, tell people, I had this discussion with a woman today. My family is now getting vaccinated. My wife actually did finally get her first vaccine, and a couple of my kids have been able to get vaccinated. And so, I'm comfortable enough that I'm very happy that my wife and kids are getting vaccinated. So I hope that they trust me enough that if I would do it for my wife and kids, I would do it for them. The other issue has been this Operation Warp Speed and the idea that it was rushed through and they skipped steps and things like that. And what I try to emphasize is that there weren't any skipped steps, like the clinical stuff that has to be done, giving it to a certain number of people first and doing some initial monitoring and then giving it to a larger number of people, comparing it to people who got placebo. All of that was still done just like any other new medicine or new vaccine. What was really sped up was the administrative process, the licensure, the oversight review, the various committees within the FDA that have to review this. And basically, each of these FDA committees probably has, I don't know how many, I imagine they have hundreds of things they have to do. And they were basically told, this goes to the top of the list. Do this first, put everything else on the back burner. And, in another vaccine that wasn't so urgent, they wouldn't have done that. And so it would have taken months and months to get it through the regulatory process. And this got through a lot faster because everyone said, stop everything else and do this first. And the other big thing is that the companies were given funding ahead of time to manufacture vaccines so that when the regulatory process was finished and the approvals were ready, the vaccine was already made. It was ready to go. And that's a new thing. People, drug companies haven't done that before. They've waited till all the regulatory steps were completed, they jumped through all the hoops, got everything approved, and then they start manufacturing. Well, that introduces, months and months of further delay waiting for enough vaccine to get produced. And in this case, I mean, literally, the moment the vaccines were approved, there were millions of doses ready to go. And so that's really how things got sped up.
Yeah. No, I think that's so important to share and understand. And Operation Warp Speed is one of those things which put all those pieces into place where we got a vaccine so quickly. But it also is one of those terms that led to some vaccine hesitancy, as people I know have said, I don't want you to rush my vaccine that's going in my arm. And so I think helping folks understand that really steps weren't skipped. These are all administrative, financial barriers that were removed. And Dr. Shoemaker, I'd certainly be interested in your thoughts on that. I know I've heard patients say there's no way you could develop a new vaccine in less than a year. And even beyond just the Operation Warp Speed, the science that it takes to develop something that fast. And so how do you respond to patients who kind of are familiar with the vaccine process and that it usually takes longer than a year and this one was quick? What things do you think kind of contributed to that?
Well, first of all, they are quick. The mRNA vaccines are quick to make. They really are. They have to have very little information, and the materials to make these vaccines are readily available. So, I mean, all they needed was the genetic mapping, which was completed and actually published in early January for the pharmaceutical companies to look at this technology, which is not new. It's been being investigated for decades now, and I think a lot of what has held it up is lack of funding and really prioritization that needed to happen. Of course, when this public health emergency got declared in January, all of that kind of made it available. We can move forward with this technology now. So. The simple matter is the materials, all they needed were the fatty envelopes that I talked about earlier, which they had already developed. They already knew how to do that. It was they had needed just some simple salts and sugars. With the rapidly spreading virus that causes COVID-19, again, the prioritization to get this done and for there to be a rapid response. I've said it over again that many times to patients that this was a tsunami, and in some ways we're kind of seeing the backside of this wave at this point. Certainly, there's the potential for more waves to be coming in the future, and I think our development of this type of vaccine and ability to do it relatively quickly, being prepared to do it quickly, because there was a lot of preparation to do this, to be able to do this, and then of course the public health emergency allowing the money to be there to fund this development.
Absolutely. I've sort of explained it to some friends and family, like, this is the overnight success. It was a few decades in the making, as sometimes happens,
That's right.
Yep, absolutely. Well, one of the things I'd like to kind of hear your thoughts on, Dr. Quint, if you don't mind, another barrier that we hear are folks saying, I'm low risk of serious COVID-19. And so why do I need to take this immunization that I may have all these different concerns with? I've got a number of other priorities. I'm low risk, so I don't need the vaccination. So what do you do to try to bring those folks around to recognize the benefits that you see on that?
I think there's a couple of different things. So first of all, and there's a analogy here, I think, to masking. Part of what we're doing is for ourselves, and part of what we're doing is for our friends, family, and community. So, when people object to masking, I tell them, you don't have to mask for yourself. That's fine. You get to make your own choice on that. But think about masking for the old person that you might see in the store, or someone in your family, or a friend or somebody that might be high risk and you don't know they're high risk. We don't know what everybody's health status is. So a lot of this is to protect others in the community, not just yourself. So that's one thing. Secondly, there are a lot of people who've been sick from COVID that didn't have, quote, serious disease. They had kind of mild to moderate disease. And again, it's been said, the vaccines are really good at preventing serious disease, to help keep people from getting hospitalized and almost eliminating the chance of dying from COVID. But there are a lot of people who are getting mild disease and they're having lingering symptoms that are lasting for weeks to months. And they're not necessarily life-threatening symptoms, but they can be pretty bad. Severe shortness of breath, fatigue, a variety of symptoms. And even 3 to 4 months out from when they got sick, they're still not feeling back to normal. And so, if you're thinking about yourself, do you really want to take the chance of experiencing that? And again, do you want to take the chance of giving that to somebody else? People need to understand that they could catch COVID and not get sick at all. There are some people who don't get any symptoms, or at least don't recognize the symptoms, and yet they can still pass it on to somebody else unknowingly. So you can't necessarily just assume that if you feel good, you're not a risk to your elderly grandmother. You might be a risk to her. And so do you really want to carry that burden? Do you want to do that to your grandma, or do you want to have the guilt of perhaps having gotten her sick without realizing it? And all of that is preventable largely, nothing's 100%, but largely by getting vaccinated.
Mhm. Yeah, I think that's the thing that's so compelling, is you think about the folks who have been so deeply impacted. And if we had had this vaccination before, they could have avoided that. I mean, it's just really compelling. And I think this is a kind of a difficult time for our country as we start to kind of gradually, and in some ways not so gradually, reopen, start to, kind of adopt some of our previous behaviors. Folks are recognizing that we're seeing some improvement in case numbers, and there's movement there. I feel like every week I'm watching it. But what do you say to folks who say, hey, we're turning the corner on this, cases are going down in my area, I don't need the COVID vaccine because of that? How do you respond to that?
I mean, the biggest response to that is that if we don't get enough people vaccinated, it's going to come back, because people are going to start. People are not going to mask forever. It's just really, really difficult. People are not going to maintain social distance forever, and people are already lightening up on that. And we see cases going back up, and we will have more surges in the future. And the only way really to stop that long term is to get enough people vaccinated. We need to get to that so-called herd immunity of whatever that is, 80 or 85% of people. The other thing is that this virus has this knack of changing. So, it changes its spots. So that's referred to as variants. And so far, the variants have been susceptible to the vaccine. So the vaccine has been protective against the variants. But there's a real legitimate concern that a variant could emerge that is not susceptible to the vaccine, and that could trigger a whole new pandemic. And so the best way to prevent those variants is to basically not give this virus space to grow and space to replicate. The more people who are vaccinated, the less people can be infected, the less amount of virus can be out there replicating. These variants occur when the virus replicates and gets a mutation through replication. And so the best way to prevent that is going to be get enough people vaccinated that it can't do that, or at least it can't do that in a large enough number to make a difference. And if we don't do that, we're at risk that we'll be living through this again, and I don't think anybody wants that.
Absolutely not. And I think you're spot on. You've shared such good information today, and I feel like sometimes we've got we've got so much transparency. I mean, you can really learn a lot about these specific vaccines, the trials that were involved. So there's so much good information, but there's also quite a bit of misinformation. It's really leading to confusion. One of the areas, the myths that I wanted to dispel as we have this opportunity to talk, and I'll kind of lean on you, Dr. Fowler, to give us your perspective on this. But I was really surprised when I started to get kind of encountered with the concern about COVID-19 immunizations resulting in infertility. And could you talk a little bit about where that came from and the kind of things that we know to disprove that? Because I think that's one of the elements of disinformation that's certainly impacting some of our younger colleagues.
Sure. Yeah, there was some concerns that the spike protein instructions were similar to protein in mammal placenta. So there was some concerns that the vaccine antibodies would attack the placenta, which there's really no. We know that just a few stretches of similar genetic code is not enough to make a match, and so when we start looking at the bigger picture, that's not true. There's no evidence that the new vaccines cause infertility. When they were studied, first of all, thousands and thousands of women received the vaccines, and at least in the in the Pfizer study, just as an example, 23 women conceived, and 12 were in the vaccine group and 11 were in the placebo group. And when we start thinking about this, if we've had of all the infections with COVID-19 that we've had, if there was a if the virus was attacking the placenta, we would see drastic changes in fertility patterns after we've had 29 million infections with COVID-19. So I think it's we can assure our women of who are hoping to get pregnant or even who are pregnant that it's it is safe, and that's definitely a big a common myth, and I've had conversations with friends about that too. So.
Yeah, and I think it just highlights the impact of misinformation and our role in dispelling it. And whatever, we've been through so much change. It's been, COVID-19 has been catastrophic for many families and communities, lives lost, lives impacted. And so, from our perspective, we're racing to the vaccine. The minute it was available, we got it. And so it can be difficult to understand where folks are coming from that are hesitating on it. And I do think it's going to take all of us with really sharing reputable information to kind of dispel some of this misinformation, but a real understanding of each individual's perspective, what their personal goals are, what they're worried about, the experiences that they've had, cultural barriers, even looking at items around health equity. And so kind of turn it over to you, Paul, to kind of talk about in this complex environment where we have a dire need to increase vaccination for all the reasons that we discussed today, but the patients who are hesitant have good reasons that are motivating them. They're worried about things. They've experienced perhaps some misinformation. Perhaps they personally experienced some outcomes that make them less comfortable with the healthcare systems that they engage with. So how do we kind of work through the various different elements that contribute to vaccine hesitancy?
Yeah, that is really a great question. And the token psychologist among you now gets to opine on these issues. But, I think we've been really clear about our intent here, which is to say, we respect folks' opinions, we respect their experiences and understand hesitancy. But we're also very much in favor of overcoming objections and getting everybody who can possibly get this vaccine to get it. But in particular, for example, we just heard about issues around infertility, which probably at least partially explains why I looked at some national surveys that are peer reviewed, so they're good and reliable from my perspective. But that women are 43% less likely to say that they plan to get the vaccine in a national survey, and that may explain some of that. So there are some reasons there, and I think that's really our goal, is to understand where people are coming from and overcome their objections in a way that is respectful and safe. And in particular, I think as regards cultural barriers and health equity, there's the double whammy with the African American community. That same published survey showed that Black Americans are 63% more likely to say they were not going to get the vaccine when compared to white Americans in that survey. And I think, it's been widely reported, and I think those of us who are interested in cultural factors know that the African American community has often been characterized and from their lived experiences will often tell us that they just have more mistrust of the medical establishment, medical research in general, and there are deeply embedded historical reasons for that. We don't have to look back too far. For example, the famous and tragic Tuskegee experiments. I mean, that's not that long ago in cultural memory for African American communities. So we understand that there are hesitancies there, but again, the pernicious part of this is that it also apparently, from what I'm reading, and you all can weigh in on this if I'm getting it wrong, but I think it's even more essential for African American folks to get the vaccine, because it appears that COVID-19 is disproportionately worse in that community in terms of higher infection rates and significantly higher mortality rates when they do get it. So again, it's particularly difficult because there's this hesitancy that's greater, but also the impact is greater. So the stakes are really even higher. And I would just like to say again, thank you all for sharing your why, because I really think there's a lot to just putting your money where your mouth is and living it and being a model. And I think African American leaders have done that in a lot of cases. Vice President Kamala Harris getting her vaccination on camera. And as we know, Dr. Fauci told us, in explaining why African Americans should trust the COVID vaccine, reported that one of the scientists who was leading the development and testing of the vaccine is an African American woman, Dr. Kizzy Corbett, who's a viral immunologist with the National Institutes of Health. And she led, the team, one of the teams that was developing the Moderna vaccine. So I think it's really about trust. I think that's where we started this conversation, and I think it all centers on that. But I would like to turn around and ask you all. When I got my vaccine back in December, the first one, I did the de rigueur posting on social media with the picture of me, trying to lead by example, if you will, show folks that I ain't scared, and that really is something that I really recommend that we do. And I had a friend of mine who posted, "Good for you. I'm just hoping enough people get it where I don't have to." So how do I respond? With all my years of training and psychological practice, I still don't know how to respond to that. So maybe you all could help me with that one.
Anyone want to jump in there on that one? That's a tough one. It is a tough one. And I think, you're hitting on what I think is so important. And one of the reasons why I think it's a good use of our time to get together as clinical leaders to kind of spend a little time talking through this is I do think it's going to go to kind of boots on the ground, those personal relationships, kind of sharing what we've learned, that, informed recommendation from a colleague, a friend, a family member. I just think it carries more weight sometimes than the sea of information folks are wading through. And in my mind, I think from our team here, we've heard a couple tips from the perspective of just the kind of gap we need to span in terms of immunization. For Compass Health, I think the most recent I was hearing is about 40%. Dr. Quint shared we're really needing to be 75, 80%. You've got a few folks who, for anaphylaxis reasons, really are the only primary contraindication. But we've just got so much that needs to fill in there. So I think one of the questions, if not you to answer this, who? then who is supposed to step up and be a part of this? I firmly believe everybody should get their vaccination, and it just can't stop there. They need to carry their water and make sure that their colleagues, their friends, their family members understand that we all have to be part of this, or we're not going to get to that point that Dr. Quint mentioned. And I do think one of the big things to focus in on for folks is the reality that mRNA viruses change. And our only hope to really keep our vaccines as effective as they are at stopping and ending this pandemic is for us all to get vaccinated, because the more this virus circulates, the more we're going to recognize predominant strains that are gonna cause a problem. And I think Dr. Quint mentioned it too, that our immunizations are working pretty good against these variants right now. But I think we just have to stop it right now before it has additional opportunity.
Yeah, and again, this is the risk of having the token psychologist on in the conversation. But my favorite class I ever taught is social psychology, and there's decades of social psychology research on diffusion of responsibility. And this is one of those circumstances where it can't be diffused. It has to be all of us, or we're not getting out of this in as good a shape as we could. So that's what I'm trying to tell my friend when he asked me that is, you don't get to escape. You don't get to skate on this one. This is your responsibility. This is where you got to think about something bigger and other than yourself, and really do it for the peeps.
Absolutely. Anyone else want to weigh in there? Thank you.
I do think also that people need to understand this probably isn't going to go away, right? I mean, even if we get to herd immunity, the virus probably isn't going to just drop off the face of the earth. We're probably going to be faced with this most likely for the rest of our lives, like influenza, for example, and we're probably going to have to get booster shots in the future. And I think the threat is probably always going to be there. And so it isn't like if you sit it out, then it'll go away, and then boom, you're off the hook. You got away with it. It's gonna be there still, and there's always gonna be a risk that if we don't stay on top of it, there'll be a new surge, either of a variant or even of the original. So that's just the way life's gonna be. We're not returning to the pre-COVID world. We're hopefully gonna have a new normal. It won't be quite as normal as it was before. Can still be good, but
Yeah. Well said.
Any other questions or comments? Anything else we need to cover while we're here today? Okay. Well, I just want to say thank you for your time. I've really enjoyed the conversation and hearing your perspectives on the questions and concerns. And as we mentioned, we all know it's just gonna take all of us. And I think in my own practice, I always very much believed whoever I'm working with from a patient perspective, you never know where that teachable moment's going to come at. Sometimes the teachable moment is the nurse that's stepping into the room. Sometimes it's the phlebotomist. Where's that teachable moment that really encourages somebody to move from contemplation to action? I'm going to do something about exercise. I'm going to do something about my smoking. We all play a role, and we all have a strong potential to impact there. So my request for everybody who has an opportunity to listen to this is get your vaccination first and foremost, and then join the fight against misinformation. And let's all work together to put an end to this pandemic. I know we're on our way. We've got some tools. We just need to execute. Any other closing thoughts? Dr. Fowler, did you have anything else that you wanted to close with?
Yeah, I keep thinking that, as we are seeing improvement, we can't let up. It's like a basketball game where the team's winning, and just we can't let our guard down. Just continue the full court press and continue to do what we can, because like Dr. Quint said, I mean, we're going to be dealing with this, so let's do everything we can. And we're fortunate in our country to have such great resources and to have the availability. I have family in Brazil that aren't as fortunate, and really, when you look around the world, we're kind of a leader in this. We're because we have the resources, and let's all do everything we can and kind of be a model for all the other countries. So yeah, I've enjoyed the conversation too.
Dr. Shoemaker, do you want to finish up with any thoughts?
Yeah, finish up. That's big. Well, I would say, what a privilege to be involved in healthcare and delivering healthcare in this time. It certainly impresses upon me the importance of continuing our efforts as healthcare professionals to build rapport and maintain rapport with the individual patients that we work with and the colleagues that we work with, and I just think it's a wonderful time just to be able to, again, even share science with people, and I think that's part of some of the difficulty. A lot of folks who have not been involved in the scientific process, that ask a question and test it and see what happens, and the kind of the shifting nature of what's happened during this pandemic. It can appear that there's been some indecisiveness, but science, this is the way science works, and I think we continue to answer questions about this and obviously other issues in the practice of medicine. And so but right now, I think we have a wonderful opportunity to move to our new normal, and certainly germ theory has been supported by this whole endeavor, and so again, I look forward to working with the patients I get to care for, those that have entrusted their care with me, and I hope to be a support to any coworkers that have questions, concerns. I encourage them to send emails, to make telephone calls, contact each one of us, and let's move forward with good information, and certainly respect folks' autonomy to make decisions for themselves. But there's good information out there, and I want it to be clear that I strongly recommend vaccination if you do not have not had an anaphylactic reaction to any of the components of these vaccines.
Wonderful. Thank you so much. Dr. Quint, do you want to give us some final thoughts?
Yeah, I was actually Dr. Shoemaker just said what I was going to say, but I'll say it again to reiterate. If anybody who sees this video has further questions, I hope they'll feel comfortable calling one of us, texting, emailing, come into my office. I'm happy to talk to somebody one-on-one and go through further questions and try to help you feel more comfortable about getting the vaccine if you're still not comfortable after this. I think sometimes people like a little one-on-one, and it's hard to answer all the questions sometimes by email or by phone calls even. So even, one-on-one, come into my office and we can chat.
Wonderful. Thank you so much. And Paul, I'll hand it back over to you. I think you started us out. And so if you want to finish us up, I think that'd be great.
Well, thank you. I really appreciate the opportunity, and have really enjoyed this talk. And I would just conclude by saying, we are in an era that requires courage. We all need to be brave and courageous. And I would just remind us that courage and bravery are not being unafraid. It's about having anxiety, having the fear, and doing it anyway because it's the right thing to do. So that's what I would conclude with. And thank you all very much for being here today. Thank you for joining us for our discussion of the new COVID vaccines. I thought I'd take a moment just to summarize some of the key points, some of the key takeaways from our discussion. And they are as follows. First, these vaccines are safe and effective, and all of our medical directors recommend getting them as soon as possible, as they themselves have. The vaccines are sort of an overnight success, it would seem, but it was a few decades in the making, as they're built on messenger RNA technology that scientists have been working on for a long time now. On that note, the testing and approval process was rapid, yes, not because steps were skipped, but because the vaccine went to the top of the list of priorities for scientists worldwide. The vaccine you should get is whichever one is first available to you. Hesitancy to get the vaccine is understandable, especially among certain groups like women who are concerned about fertility and the African American community, which has valid historical reasons for mistrusting the medical establishment. But there's no evidence that the vaccines are in any way related to infertility. And it's even more important for African Americans to get the vaccination, as they're disproportionately likely to be infected with the virus and to die from COVID-19. So please get vaccinated at your first opportunity so as to contribute to reaching a level of immunity in the population that will allow us all to do more of what we love to do sooner. Thanks for joining us.